Afternoon. I knocked on the door, opened the door and closed the door for the patient's privacy. Before I approach the patient, I wash my hands. After I wash my hands, I come to the patient, introduce myself as RN Hayes. And my next move is to do a patient identifier. I would check see if he had an armband on here. I check for 1, his name, and 2, his date of birth. I checked that to patient identifier. The next thing we would do is let the patient know we're going to do an eye test. The equipment I would use would be a pen light for the eye test. So, first thing I would do is I have the patient do a Snell test. Snell test, if that was the door, it would be a sign on, it would be a chart on the door with letters from top to bottom. I would have the patient wear his glasses if he has glasses. If not, I would tell the patient to cover one of his eyes and read each line. I would tell him to do that again, but covering the other eye until he could not read any further. We had just completed the test. From what we could see, Ted has a 20/20 vision. His eyes weren't tearing. He was able to hold his hand. There was no issues. The next thing we're doing is we're going to do a confrontation test. Confrontation test is for a visual acuity, where he would cover one eye, or peripheral vision, peripheral vision. So I would have Ted cover his eye, and I would take my finger and I asked Ted to let him know as soon as he see a finger. Once you see a finger, I bring the finger to the front. Now, we would do this 6 times. We do it from the top to see a finger, do it temporally, see a finger, and we do it from the bottom, see a finger. I would ask Ted to do it again, cover his eye. I do it from the top, temporal, and from the bottom. That is his visual field test. The next thing I would do is I would do a test on his pupils, where I would shine a light, take it off, and based upon that, I would see if his pupils dilated and constricted, or dilated, constricted in relation to the light. Now, what that is it's called PERLA, pupil eye reaction and accommodation. Oh boy, I bet you. So that tests his eye acuity, and that means now the next thing I would do is I would check his conjunctivas. Well, I pull down here. I would check his sclera, see if the white of his eyes, make sure they're not red. No redness to his eyes were fine. I would inspect the interior of the eyeball structure, cornea, lens, iris, and pupil. I'll check size, shape, and quality of the pupillary light refraction and accommodation. Also, I would inspect the optic disc, color, shape, margins, cup, disc, and ratio. I would inspect the retinal vessels, do the numbers, color, artery veins, or ratio, crossings, and pulsations. Also, I would check for general background color, which should be a pearly gray, I believe. The next thing we're going to do is his nose. Next thing we're going to do is his ears. I would inspect Ted's external ear for size and shape, position and alignment on the head. I inspect his skin condition. I check for any lumps, lesions, movements of his cartilage on his ear. And I would check for tenderness. Also, external, I would check for external auditory medius, like size, swelling, redness, discharge, serum lesion, and foreign bodies. Next thing I would do is I'd use an otoscope for his external canal. I turn it up this way, tip it in. I make sure he has his head tilted. There also should be a attachment that I would put on here to put in there. But before that, I would do a visual inspection. I would look for any redness or swelling in the wall. And once I did that, once I checked it, I would look at the scotoscope. I'll check the tympanic membrane for any color and characteristics. I would note position, flatness or boldness, or if it's retracted. I check for integrity of the membrane and no perforations. Next thing I would do is I would do a hearing test. I would whisper in his ear and see if he had noted any behavioral response to conversational speech in a whispered voice. That would be end of the ear test. The next test I would do would be his nose test. I'd inspect the nose for external nose for symmetry, any deformities, lesions. I would palpate and test the patency of each nostril. I'd inspect the nasal cavity for integral nasal mucosa. I use a septum for deviation. I check for septum deviation. I perform for our perforations, bleeding, noting color, any exudate, swelling, or polyps. I will palpate the sinuses for any tenderness. And that would be the end of that test. The next test I would do would be, and once again, as I go through each test, I will let the patient know what I'm doing, get started. As I finish one test and start another, I'll always wash my hands or any equipment. The next test I would do would be a mouth and throat test. I inspect it using a pen light. I would check the lips, teeth and gums, tongue, buccomuscular, color, intactness and structure, and I would check for any lesions in the mouth. I will palpate the uvula for integrity, mobility, and person's phonetes. So I have them say something as I was checking it. Also, I'd have him take out the tongue. I push the tongue to the side. For color, any exudates or lesions for the mouth. Now, once I've done all of this with the patient, I take my equipment, wash it off, put it away, wash my hands, then document. Now, at the time of documentation, after I finish, I ask the patient, do they have any questions or any concerns? Also, this is the time for any teaching, health promotion, stating that it is wise that he comes in on a regular checkup or visit. And then once again, ask the patient one more time if they have any other questions or concerns. If not, I say this is the end of the visit.